California is tackling opioid addiction with a new program. It's called MAT, offering prevention, treatment, and recovery services. And here to tell us more is Marlies Perez from the Dept. of Healthcare Services. Welcome to Bay Area Focus.
Great, thank you so much.
Okay, so first let's talk about the problem. We've heard so many stories in the news about this opioid epidemic. What are the statistics about the impact of it?
Yeah, so nationwide, we're struggling with this epidemic. About 130 Americans die each day from an overdose. And here in California, we've had back in about 2017, about 2,000 individuals. And unfortunately, some of the numbers are beginning to climb even higher.
Yeah, that's what it seems like, that we're just hearing more and more about this. Is this considered a chronic relapsing disease?
Yeah, so all substance use disorders are chronic relapsing brain disease. And what's challenging with opioids is when an individual takes too many opioids, we have these receptors in our brains, and the opioids come in and overwhelm those receptors, and then the individuals stop breathing, and then they die.
So what is this medication-assisted treatment, or you call it MAT?
Yeah, so one great thing about the opioid epidemic, which seems like how could there be a great thing, there's medication that can treat the addiction. And so what's really happening with an individual that has an opioid addiction is it's changing that brain chemistry. And so what the medications do is they come into the person's brain and they level all the different serotonin levels and all of those different chemicals, and they help them to lead a normal life. It takes care of any of their symptoms of withdrawal that they're having or cravings for the opioid, and then they can just live a life like you and me.
But some people would say, okay, it's medication treating medication that was the problem in the first place.
Yes, and thank you for bringing that up. One really important thing about medication-assisted treatment is you don't get the high. And so it's really leveling off within the normal range in our brain chemistry that is really helping to almost kind of fix the damage that has been done and really help that individual, like I said, get back to their normal everyday life.
So it balances them out. Okay, so if you think someone is addicted, someone in your life, a family member, what do you do?
Yeah, so one of the real struggles with this epidemic is this has a lot of stigma around it. Folks don't want to talk about it. And so unfortunately, there's a lot of shame for individuals that have this addiction. They suffer in silence a lot. So I think the most important thing that all of us can do is talk about it, become educated about it, understand it's a disease. Nobody ever wakes up and says, you know, I want to become addicted today. That is not what is happening. And it's this, I think what's helping with this epidemic is it's showing that addiction does not discriminate. It's hitting all races, ethnicities, all ages, yes. It's hitting our senior population really hard, our young people even harder. And so we need to talk about it. We need to continue to talk about it and understand that recovery is possible. There's a lot of people living in long-term recovery, not just from opioids, but also from methamphetamines, alcohol, other substance use disorders. So we need to have these conversations. And then if you have a loved one that needs help, you need to encourage them and continue to encourage them to seek treatment.
Is the opioid addiction, is that a tough one to bring to light? Because sometimes, you know, they don't think they are addicted to it. They need it.
Yeah, so what individuals can do, or if they're not really sure that they have an addiction or not, they can get an assessment. And there's all types of places that they can receive an assessment. They can call their local behavioral health department. They can actually go to our website, choosemat.org, and they can see all of the sites that can provide them assistance, not only with opioids, but for other drugs. And just talk to somebody and really get some information.
Marlies, thank you so much for coming on the show and telling us about this.
Wonderful, thank you so much.
All right, and for more information about California's MAT expansion project, you can email them at dhcsmatexpansion@dhcs.ca.gov, or you can go to choosemat.org.